Ever since the founding of this company by Fred nearly 50 years ago, we've worked hard to build networks to span the globe. And FedEx Corporation is comprised of multiple operating companies: FedEx Express, FedEx Ground, FedEx Freight, FedEx Logistics, FedEx Office, and FedEx Services, each with unique strengths. And the power of our networks is such that FedEx can pick up a shipment in almost any part of the world and deliver it to almost any other part in a matter of days. And we operate in more than 220 countries and territories, allowing us to move critical supplies where and when they're needed the most. And it's precisely this power that will come in handy in delivering our very important mission at hand, the mission to distribute COVID-19 vaccines. And at FedEx, there's a sense of purpose about this mission, a true recognition of how important this work is. In fact, around this company, with the sentiment that this is indeed who we are and what we do. Time-definite express transportation of critical shipments like COVID-19 vaccines is exactly what our FedEx Express air network was built to do. And our FedEx Ground network is our ground parcel network that transports day-definite packages, both for businesses and increasingly for residences. In fact, the network is perfect for your holiday shopping. We've been preparing for the Shipathon. We're handling unprecedented and record-breaking levels of volume for customers during this season. We are very much in the midst of Cyber Week, and which is shaping up to be the busiest week in our company's history. So this distinction between our networks means that each will have the dedicated resources they need to deliver quickly and safely. Simply put, a global health crisis of this scale requires a network of our scale to address. I will now turn it over to Don Colleran.
Raj, I was supposed to actually introduce Governor Lee. Sorry there, Governor, it's your state here, so why don't you take it over before Don talks.
I thought that was great, though.
You know what? Actually, that was perfectly appropriate, Raj. And thank you, Fred. And all of the FedEx team members, were honored to be in this spot. A great global logistics company. Proud to call Memphis, Tennessee home. You've made all Tennesseans proud because of the pivotal role that you play in delivering life-saving vaccines to all of America. And we're proud of the work. We're glad to be here today. Mr. Vice President, Secretary Azar, Dr. Redfield, thank you, not just for being here, we're honored by that, but we thank you for your service to this country, navigating us through a crisis this year. In some ways, 2020 has been swallowed up by COVID and the shock waves that it has sent through all of our lives and our healthcare system and our economy. And we're all too familiar with the tragedies of this pandemic. But today is a day of hope. It is a hopeful reminder of the power of American innovation, of the power of the private sector, the power of a healthcare system. In our state, the healthcare system is global. It is a major contributor to the global healthcare system. We're proud that Tennessee's healthcare system is second to none. We have institutions like Hospital Corporation of America and other great healthcare companies, or Vanderbilt University, great research institutions that have been a part of this. And we're proud that Tennessee's industry, healthcare industry, has been an integral part of fighting this virus and of developing and implementing a strategy to distribute a vaccine. And not only our healthcare industry, but all of Tennesseans. Our researchers and frontline healthcare workers, our doctors, our teachers, our small business owners, our famous Tennesseans like my friend Dolly Parton, who contributed major financial gift to the development of Moderna vaccine. Tennesseans have stepped up, and this all-hands-on approach has been one that we've been proud of. And in the midst of this pandemic, there is a new challenge every day. But in our state, we decided early on to develop a regimented approach. We know that you can't mandate your way out of a pandemic, but you can master infrastructure and As an engineer, I was committed to develop the best infrastructure possible. And that's what we've tried to do here in Tennessee. Three components of that, primarily making sure every Tennessean can test free, regardless of their symptoms, making sure that we at the state are partnered in a strong, good faith partnership with our healthcare providers, and then developing a strategic and effective way to deliver this vaccine. If we do those three things, then our healthcare providers can have capacity. Tennesseans could get treatment for a car wreck or COVID-19. Our schools can stay open, our businesses can stay open, our prosperity can be preserved, and at the highest level and the most important thing, we can save lives. And that has been our strategy and our commitment. I've brought with us today to speak our members of our Unified Command Group, Dr. Lisa Piercy, head of our Department of Health, Patrick Sheehan, our TEMA Emergency Management Director, to talk about our distribution plan. I've also brought along Dr. Wendy Long, who's the head of the Tennessee Hospital Association, which has been a tremendous partner for us throughout this pandemic to give a provider perspective. Our country is at a monumental moment, we believe, and we're staring down a virus that doesn't discriminate, and it certainly doesn't care about disruption, but we believe that we are set for the task. And Mr. Vice President, we are grateful. I'm thankful for your relentless work by way of the Coronavirus Task Force. You and I have interacted many times over the last several months, as you have with governors all across America. And that your approach has allowed governors to have a nimble response. And that's made all the difference in Tennessee, and we're grateful for that. We also, sir, are grateful for your leadership and for your service to this country for these past 4 years. Your faith, not only in God, but in American people, has made this country a better place to live, and we're grateful. Welcome, Mr. Vice President.
Well, thank you very much, Governor, and to Fred Smith and Raj. I know I speak on behalf of President Trump and on behalf of the members of our administration who joined me here today when I say, well, thank you. Thank you for your partnership in the course of this pandemic here at FedEx. Governor, I also want to take a moment to thank you and Maria for the way you have led the state of Tennessee through this challenging year with compassion, with professionalism, with ensuring that every family in Tennessee would have the level of care that we would want a member of our family to have. I'm humbled by your kind words for our team, but the people of Tennessee, I think, can be very proud of what Governor Lee, of what your state government, what your local health officials, your state health officials, and your dedicated doctors and nurses have done throughout the course of this pandemic. And so I thank you. I thank you for your leadership. But we're here with enjoying the hospitality of the great Tennessee National Guard, and I thank you all for welcoming us to really put a focus on a great season of hope for the American people. We've gone through a challenging year. With cases rising across the country, we're still going through a challenging time. We all have a role to play. But we're here to say thank you to an extraordinary partner throughout this year in this effort, and to say that because of the efforts at the state and federal level, and because of the great work of our research companies and pharmaceutical companies, and because of a great partnership with FedEx and other companies around the country, that help is on the way. We are just a matter, we believe, of days away from when we will begin to distribute tens of millions of doses of a safe and effective coronavirus vaccine to the American people. But this partnership with FedEx, as Fred Smith knows, and as Raj and Richard and the whole team here knows, is hardly new. When we were confronting, as you remember, Governor, the challenge of of meeting the needs of personal protective equipment to healthcare facilities around America, we created what was known as the Air Bridge, literally a global supply chain that would identify and help to transport the gowns and the gloves and the masks that would be necessary to care for the American people. And to Fred and Raj and the whole team here at FedEx, I want to say thank you for being such a central and effective part of the Air Bridge project and the ongoing effort to continue to meet the needs of our healthcare providers all across America. But building on that partnership, we're here today to really put a focus on Operation Warp Speed. It would be literally in the month of January, as Secretary Azar will explain, that we received the genetic coding for the first time for the coronavirus, the sequence for the virus as it's known. We went straight to work in the month of January on developing a vaccine, working with Moderna and other companies, and working through the National Institute of Health. Under the President's leadership, we identified and secured some $10 billion to invest in the development of a vaccine. It's amazing to think that while we were still standing up our national response in the early days of March, we literally, in 6 short weeks, we were in phase 1 of the clinical trials for a vaccine. And as all of the American people know, and as the world has marveled, we now are in phase 3, and the FDA is in the process of reviewing final approval of not 1 but 2 safe and effective vaccines for COVID-19. We anticipate, as the FDA does their work thoroughly and carefully, and we continue to hope and anticipate that those approvals will come with an emergency use authorization. Operation Warp Speed is really in 2 pieces. The governor understands this well. The first piece is to develop a vaccine. President Trump would say when he stood up Operation Warp Speed back in May of this year that it was our hope that we would have a vaccine. It was our goal that we'd have a vaccine before the end of the year. In August, the president promised that we would have a vaccine for the American people before the end of 2020. And as we stand here today, it's deeply humbling to me. And I have a heart filled with gratitude for these extraordinary scientists and researchers, for the incredible work of our HHS team and NIH to be able to report to the American people that we have not 1 but 2 safe and effective vaccines that are on the cusp of approval. But that was phase 1 of Operation Warp Speed. Phase 2 is getting the vaccine into tens of millions of Americans. And as Dr. Redfield, the director of CDC, will explain, the CDC is making recommendations about where the first 20 million doses will be distributed before the end of the month once approved. It's recommendations because ultimately, as Governor Lee knows, the state of Tennessee and every state and territory in the country will make those decisions for themselves about who will receive the vaccine in the early going. But making sure that whatever plan that our governors and state health officials determine most appropriate, that we're able to deliver those vaccines literally within a matter of days. In fact, as you will hear today, Operation Warp Speed, working with FedEx and other great companies, is in a position that we expect to be shipping COVID-19 vaccines within 24 hours of approval, and we expect vaccines to begin to be administered to Americans in that first group within 24 hours of that. It's an amazing thing. Only in America could you see the kind of innovation that's resulted in the development of a vaccine in record time, in less than 1 year, but only in America, with this public and private partnership that we forged with FedEx and with other great companies, could you see that vaccine delivered and made available to some of our most vulnerable and to those that are working on the front lines of this pandemic in the country. So I'm really here to make sure that, Governor, that you have the full range of counsel from our team, but I'm also anxious to continue to hear the details of FedEx's plan. I know you're poised to spring into action the moment that the vaccine is made available and the emergency use authorization is made. But what President Trump said to me from early on was that we wanted to forge a seamless partnership state governments. And Governor Lee, you've been exemplary of that here in Tennessee, and today I hope is an encouragement to the people of this state and to people all across America that help is on the way. While we have a ways to go, while we all have a role to play, we all need to continue to practice all those things that will protect our health, the health of our family in the days ahead. I think every American can be proud that we are just a matter of days away in this whole of America approach of delivering a safe and effective vaccine to the American people. So I look forward to hearing the details of FedEx's plan for delivery, and I'm going to recognize a couple of members of my team that will catch you up on Operation Warp Speed, our best recommendations, and then Governor, we look forward to hearing more from your team, from the team here at FedEx about how we take these vaccines and deliver them at the point of the need. And it's an honor to be with you. And Fred, you and your whole team have our heartfelt thanks for all you've done to date and all you're about to do for the American people. Secretary Azar?
Well, thank you very much, Mr. Vice President, and for pulling us together, and thanks to Governor Lee for welcoming us and for your long partnership during the challenges of this year. And I also just want to express our appreciation to FedEx, as the Vice President did. We've had a long relationship with FedEx, whether it's related to our strategic national stockpile or now this next chapter of our partnership in distributing safe and effective vaccines to the American people. We're just so happy to be working with you. And thanks to President Trump's leadership and his complete support for Operation Warp Speed, that's exactly what we're about now, which is the likelihood that we will soon be distributing safe and effective vaccines to the American people. And I wanted to give an overview of how that distribution and administration will work. You know, when we reviewed the early contracts for vaccine development and we began planning out how we could deliver on the President's goal, his unprecedented goal of having a safe and effective vaccine by the end of this year, it was clear we needed a modern-day Apollo project or Manhattan Project that mobilized the full resources of the U.S. government, but also leveraged the private sector. We had to solve three challenges, as the Vice President mentioned: distribution, development, manufacturing. So we worked to set up three critical partnerships. First was a partnership across departments, especially with the Defense Department, which brings just tremendous logistics, operations, and procurement capabilities. The second was a partnership of the federal and state governments, because the solutions have to be locally led. And third, it had to be a public-private partnership, as every great initiative like the Apollo project or the Manhattan Project were before it. The federal government had to do its part, state and local governments needed to do their part, and the private sector needed to do its part. As our great business leaders here know, people is policy. So one of my first tasks was to find the right people to run this complex partnership, and we just are so privileged that we have Dr. Moncef Slaoui, who could work to combine the efforts of public researchers and private developers, and then the Defense Department contributed General Gus Perna, who could help oversee the incredibly complex logistical operation of manufacturing, distribution, and administering vaccines. I'm so grateful for all their work and the work of their incredible teams, and it's a tremendous honor to get to work with each of them every single day. We made it a priority to enlist the military because while HHS has a great deal of public health expertise, we have never executed on a logistics, operations, and procurement project on this scale ever before. But the key with bringing in the military wasn't because it meant that we could commandeer Army trucks. Rather, it meant using the military's expertise in working with the private sector and directing supplies where they need to go. The distribution of the physical vaccines from the factory to the front lines will generally be done by the healthcare distributor McKesson, which works with FedEx and other partners who do the actual shipping. In the case of the Pfizer vaccine, Pfizer will ship directly through FedEx, and we will use McKesson to marry their product up with the vaccination administration kits that Operation Warp Speed has procured and assembled, over 100 million assembled already. States are in charge of telling us where those vaccines should be shipped. They've been working on their plans with CDC for several months now, and as Dr. Redfield will explain in more detail, States can use the recommendations of the CDC's Advisory Committee on Immunization Practices, the advice of the National Academies of Science, and their own best judgment to develop the best allocation plan for their own citizens and situations. States have different circumstances and are in different epidemiological situations, and state leaders like Governor Lee are in the best position to take these general national recommendations and translate them into more precise guidance that fits their state and their conditions. In general, states will be giving us information about providers to whom we'll ship vaccines, pharmacy partners, hospitals, community health centers, and the like. We've reached agreements with pharmacy chains and independent pharmacy networks so that states can have products shipped directly to them, where those private partners will handle administration. That includes, for instance, an agreement with CVS and Walgreens to administer vaccinations at our long-term care facilities. Those are our nursing homes. We've paid for the vaccines, we paid for the shipping costs, and the administration costs for these private sector partners will be covered by health care payers, private insurance, Medicare, Medicaid, and our program to cover COVID-19 expenses for the uninsured. To give you a sense of numbers, the first week's allocations for the two vaccines with data submitted to the FDA are approximately 6.4 million doses of Pfizer and 12.5 million doses of Moderna. Those are tentative numbers based on our best assessment of how many doses will be ready to ship when an emergency use authorization could be announced. We'll send half of those doses initially to ensure that the second dose requirements are available 21 and 28 days later. Jurisdictions have received the numbers they'll get from this allocation in the Tiberius platform that we've constructed, which is also where they're going to tell us where to send vaccines. After that initial shipment, we expect to make weekly allocations, and we expect, as the Vice President said, to have 40 million doses to cover 20 million Americans by the end of December. Finally, if I could just give a commercial message here, I want to mention that many Americans can play a role in our fight against COVID-19 by donating convalescent plasma, a promising treatment for the disease. If you are within 3 months of recovering from COVID-19, you have the chance to donate plasma and you can help save a life. Over 250,000 courses of convalescent plasma have been administered to Americans to help prevent severe consequences from COVID-19. Millions and millions and millions of Americans have recovered from COVID-19 in the last several months, and they could be eligible to donate. Please contact the American Red Cross or your local blood bank, or go to coronavirus.gov for more information about how you can volunteer and give the gift of life. Thanks to the President's leadership and support of Operation Warp Speed, as the Vice President said, we've got such a bright future ahead of us. The end is near, but we need you to hang with us. Stay with us a bit more as we bridge to that bright future. Because of Operation Warp Speed, the President and the Vice President's leadership, hope and help are on the way. Thank you all for joining us for this roundtable today. Mr. Vice President, thank you for convening us, and I look forward to continued work with our partners here today to make that bright future a reality. And now I'll turn it over to Richard Smith, who's the Regional President of the Americas and Executive Vice President of FedEx Express, for a continuation of some of the details of what FedEx is doing for us.
Richard, you may want to let Don make a couple of opening remarks. Yeah.
Thanks, Secretary Azar. FedEx is honored to work with you and your team on Operation Warp Speed and other initiatives this year to bring PPE and healthcare resources into the United States. We've spent decades building out this incredible feat of industrial engineering that we call the FedEx Express network, which is the key to doing what we do so well and what we will do in this distribution effort to aid the American public. I would like to hand it over to my boss, the CEO of FedEx Express, Don Colleran, to talk a little bit more about that network, and then I'll pick back up from there.
Thank you, Richard. We're honored, sir, to have you, Vice President Pence, Secretary Azar, Governor Lee, Director Redfield, and our friends from the state of Tennessee with us here today in Memphis. You're in our worldwide hub, and as you could see as you arrived here today, this is the heartbeat of our global operation. We have over 250,000 Express team members worldwide, and they're so very proud of the role that they played right from the beginning of this pandemic, and are committed to do right to the very end, and we're so ready to handle the expedient delivery of this COVID-19 vaccine. It goes without saying, it's been one of the most challenging years in our history, but also the most rewarding, as it truly validates our purpose in the recovery of so many families, communities, and even countries. A team of true heroes that I'm proud to serve with, that has stepped up in so many ways to support the communities where they both live and work. Now, as a pioneer of the express delivery system, FedEx Express has a long history of supporting relief efforts whenever a disaster strikes anywhere in the globe. We truly see it as our purpose and responsibility to use the massive resources we have during times of good times and bad times to relieve those efforts. It's truly our culture. We have a unique air and ground network comprised of almost 700 aircraft, the largest all-cargo airline in the world, I might add, almost 80,000 motorized vehicles, 2,000 stations around the globe, and we're in over 220 countries and territories around the world. Now, at Express, we have extensive experience in handling the dedicated services required for shipping sensitive healthcare goods. And we've been diligently planning with our healthcare customers, with federal, state, and local officials to support this vaccine distribution. It's truly teamwork at its best. So, ladies and gentlemen, FedEx Express is ready, and we are grateful for the opportunity to serve in this capacity. As Raj says, it's who we are and what we do. So with that, I'd like to turn it back over to Richard Smith, our President of the Americas and EVP of Global Support, for some details, and he's really at the heartbeat of what we're doing here at FedEx Express to assist in any way we can in the movement of these vaccines.
Thank you, Don. First of all, I'd like to echo my boss and my chain of command here in thanking our FedEx team members, both here in the Americas and around the world, for their outstanding work in the midst of the most challenging year for the transportation industry in modern times. They are absolutely positively the best in the business and our heroes. Over the past year, as Raj alluded to, we've adopted a new motto at FedEx. This is who we are and what we do. FedEx has a long-standing relationship with the federal government and is a proud member of the Civil Reserve Air Fleet Volunteer Program. We also deliver relief both here and abroad in communities in need via